Hello, my name is Dr. Fred Anderson, and I'm an associate professor at Florida International University's Herbert Wertheim College of Medicine. We are pleased today to present our poster entitled Incorporating Medical Students to Address COVID-19 Vaccine Hesitancy in Underserved Communities. I'm joined today by my poster's co-authors, Physician Associates Catherine Bussato and Shandy Brito, and medical students Cesar Laranquent, Samantha Trins, and Stephanie Martinez.
The background of our project is the COVID-19 pandemic and the vaccine hesitancy under underserved communities. There's a lot of misinformation, and the World Health Organization identifies vaccine hesitancy as a global health threat. In Miami-Dade County, Florida International University serves the underserved population and uninsured through the Green Family Foundation's Neighborhood Mobile Health Centers, where vaccine hesitancy is common. A lot of clinicians feel too time constrained to fully counsel patients on COVID-19 vaccines during office visits.
So when we began this project, our goals were threefold. First, we wanted to launch a quality improvement project with medical students to promote COVID-19 vaccines for uninsured adults that were seen on our mobile health centers. Secondly, we wanted to empower medical students trained on motivational interviewing techniques to be able to speak by phone with unvaccinated patients regarding vaccine hesitancy. And third, we wanted to track the progress that was made, identify any potential barriers encountered, and aim to push the vaccine rate to 50% or higher in our mobile health clinic population.
For project design, we focus on adult patients seen on the mobile health centers since June 2019. We then had training sessions where second-year medical students were educated on COVID-19, vaccine, and common reasons for hesitancy, as well as motivational interviewing skills to promote a patient-centered approach. We also ran reports to identify unvaccinated adults and store their information in password-protected spreadsheets. These spreadsheets were then divided by language, so we could facilitate calls by student language skills and need for interpreters. All calls were noted and notes were sent to attendants for review, and then we had quarterly reports to track vaccine rates. The QI project was launched in summer 2021 with 18 medical students recruited and trained. And we had monthly meetings for students where they were given feedback, encouraged, and we were able to share our success stories.
When we first began this initiative, we had 873 adult patients at the mobile health clinic. And of those 873, only 133 patients had been vaccinated with at least one dose of the COVID-19 vaccine. 3 months into the project, we reassessed our numbers, and at that time, of the 930 adult patients that we had been seeing on the mobile health clinic, 318 of them had received at least one dose of the COVID-19 vaccine. The most recent report that we pulled in January of 2022 had 958 patients seen on the mobile health clinic, and of those, 395 had received at least one dose of the COVID-19 vaccine. So our results show that after 6 months of hard work and many phone calls addressing vaccine hesitancy in our community, the vaccination rate improved from 15.2% to 41.2%, which was a 26% improvement.
So through this project, we learned that vaccine hesitancy can be overcome, and medical students taking an active role can help promote health equity in underserved populations. However, there were some challenges experienced during this project. Funding for free COVID-19 vaccines recently ran out, and cost barriers have been continuously emerging. Fortunately, vaccine incentive gift cards are now launching after this project was awarded grant support. However, comparing vaccine rates in the mobile health clinic community to local data has proved to be a challenge, as there are concerns that Miami-Dade County rates may be inflated. Additionally, medical students are now transitioning to clinical years, so there will be a need to recruit new students to carry this project onward. Regardless, this project was a great start to tackling this issue at hand, and we wish to express our sincere appreciation to the rest of the volunteer student team members. We thank you for your time and welcome any feedback or questions you may have.